You're here with me, Gurpreet Sandhu, at Parliament, and we're here to cover a special event looking at the challenges and issues faced by disabled black and minority ethnic children. There are over 1 million disabled children and adults in England alone, and over 44% of them tend to live in household poverty, as compared to 17% of the population. Some of this is due to a lack of awareness and also the inability perhaps to communicate with others around the issues faced by families, carers and children of disabled backgrounds. And we're here today to look at the launch of a new briefing paper to Parliament by a charity that tries to address the issues faced by black and minority ethnic disabled children called Include Me Too. So before we go inside, let's meet Parmi, the Executive Director of the charity. We're here now with Parmi, the Executive Director of Include Me Too, a charity that aims to tackle some of the issues and challenges faced by disabled black and minority ethnic children, carers and families. So Parmi, can you tell us a little bit more about the charity?
Yes, certainly. The charity, in the heart of it, central to it, is parents and carers and their children. I myself have got a son who's got complex needs. He's 13 years old now. And it's really about us having a voice and being able to influence services for our children and to make sure we can get best for our children. The other part of our work is about championing the rights of all disabled children and young people, and we even have a National Charter of Rights for disabled children and young people that has been signed up by government officials and many national charities. And the other key area is really about how we can all work together about increasing awareness about disability amongst our own communities and taking responsibility to ensure that the future looks a lot brighter for the children. There's more of acceptance and understanding about those issues faced by many families in our community.
Sure. And how did you yourself get involved?
By having two gorgeous sons, and my youngest son was born quite early and he had lots of complications. So my youngest son has got severe learning disabilities, dyspraxia, vision impairment, etc. And really it was about, right from the outset, realising that it was going to be a challenge, and the journey of my son was going to be slightly different than what I envisioned, obviously before he was born. And it was making sure that if I can't be his champion, who else is going to be his champion? So as any mother would do, sure. It's like making sure you're getting the best for your children. And in this instance, obviously, it was just learning a different way of doing that to make sure I could meet my son's additional needs.
Sure. And Parmi, what is a briefing paper, and actually what is the importance of the event that we had today?
Definitely. The briefing papers come through because it's been nearly over 10 years that we set up Include Me Too. And it's very much trying to work with local authorities and work along with government to say these are the issues that are really important to our families. And after 10 years of knocking on doors, etc., and working and trying to work with local authority and service providers, we still have found that lots of black and ethnic minority families, black, African, Caribbean, Asian, new asylum seeker, refugee families, families with disabled children and people, they still are not getting access to services, are not sure about their rights and entitlements, are still not able to influence just some of the change within to support their child, let alone at a local level. So the briefing paper came about to evidence that there is this need, and it's still a real pertinent area that needs to be addressed. So we were initially going to look over 10 years of research. We ended up going as far back as 15 years, 45 different resources and studies we looked at, went out and met many parents and carers, and picked up some of the key issues that was causing barriers and difficulties for our families to get fair services and to make sure that their children's expectations and aspirations can be met. So hence the briefing paper today was launched with parents and carers, people in policy roles, and also it was great to have a House of Law representative there and the Minister for Disabled People, Maria Miller, there to launch this briefing paper, and we're hoping that they will follow the recommendation solutions. And we really don't want to be here in 15 years' time. My son at that time will be 28 years old, and many other families, children will be a lot older as well. We really want to see some changes, and we want to make sure that they really do take on board that there needs to be a different approach of how to engage with our families, how to empower our families, and how to make sure that the services support our children's cultural needs.
Sure. So what are some of the issues, and what are some of the recommendations the paper has put forward?
Definitely. Some of the issues has been definitely, as I said, low access and information to these parents and carers. Parents and carers not being aware of their rights and entitlements, language and communication difficulties, and it's not just about information being translated or interpreted. It's about families being able to be involved in their children's assessment and reviews, understanding the system, understanding how to even get a social worker. The other area has also been about parent and care representation. Our parents are very underrepresented in representing those decisions made locally about our children. And then also we've got the community and voluntary sector who do a huge amount of work with these families, but because they are not resourced and funded, they are having to close up, and these families are left even in a more of a difficult scenario really, because they haven't got the support they could get from their community. So one of the recommendations that we're putting forward in solutions is we are at the moment trying to gather as many parents and carers to join our cause, get in contact with us, become a member of Include Me Too, have your voice heard, share your stories, share your experiences, because that gives us evidence to kind of really lobby hard really, and really to support and increase the awareness of service providers about what best might suit our children's needs. And then also at a governmental level, that by parents getting involved, we'll be able to influence some of the national policies that impact us on locally. And I think the key message we're giving, we have to do this together as a community, with yourselves from Sangat Television and the Sangat really, and also from parents and carers, our families, our local, our businesses. We all need to work together to make sure that these families' needs are actually addressed.
Sure. And to quote the current Chancellor, there simply isn't enough money left. What can we do in this time of austerity to help to try to address this issue?
I think basically what needs to really be done, and one of the things I know that I came out from the briefing paper and thought I really hope that's an action they're going to take, is we understand there's no resources. We're asking them to really look at their existing resources, look at the current contracts that they have awarded in November last year regarding support and aspirations, look at the future programmes they're putting together for fulfilling potential, and see how those can actually address and be and have resources reallocated possibly, and have a refocus in terms of outcomes, in terms of black and minority families with disabled children.
Sure. And just a final message, how can people get more involved? So do you have a website?
We do have a website, www.includeme2.org.uk, but by all means get in contact with us. We are currently going to be launching our Facebook, and it's about people sharing their stories, their experiences. Obviously, if people want to do fundraising for us or hold events, help us to actually reach out to more families and carers, that would be absolutely fantastic. It is about, to make that change, we have to work together, and I'm really hoping, and I'm saying this on behalf of Include Me Too, we can't do it without our community. So we're appealing to our community to support these families and to ensure that they can have better outcomes in the future.
Wasn't that inspirational? Now join me as we go inside and find out more.
Well, interestingly, on Saturday I was at a short break project in my own constituency run to support children with autism, and so I know exactly how those sorts of 2 hours on a Saturday morning can make a real difference. Parents to be able to get that sort of support, to be able to go and meet other parents, but actually really importantly for the kids to go to an environment where they can go, relax, and not feel under any pressure. So I know firsthand how important those are. That money is money that's given to local authorities, and local authorities really have to make the decisions about how it's allocated. And they'll want to make sure that they're being fair about the allocation of that funding. Firstly, because local authorities have a duty to be fair in the decisions they come to, but actually much more importantly than that, because they'll know that different communities in their area will need different sorts of help. So my advice to you would be to obviously work with your local authority to really understand how they're judging those bids, and making sure that the sorts of bids that are going in are meeting the bidding criteria set out by the local authorities, because the funding very much is there, and is I know can be doing so much good. And I think the answer to that has to be by showing the real value that parents can get out of that sort of support. And I think whether or not it's parents from BME communities or indeed anybody with a disabled child, we all know that the biggest challenge can often be having the knowledge as to how to make the system work for your family. So across the board, people need support, but particularly I think parents who may be from a BME community can need particular support to know how to put their case forward in a really persuasive way and to fight for the support that their children need. So I'm not sure I can give you a direct answer on how to encourage local councils to do more of that, other than to say I'll probably take that away and talk to my colleagues in the Office of Disability Issues to see if there's anything that we could be doing to encourage local authorities to understand the value of that, over and above that we're doing with our Ambassadors programme and the user-led organisation programme that we're running. But see, I see that as being a role of user-led organisations too. Actually, I'm a great fan of having disabled people come into the meetings that we're having with different organisations to explain it from a perspective of a disabled person. And I think the more we can do that, whether it's with parents or with other organisations, I think the stronger we can be.
Okay, basically all of you have been given a copy of the briefing paper, and I have to say this has been very rewarding, the fact that we're here today, and we are hoping, I'm sure that I'm speaking on behalf of a lot of people, when you're constantly trying to open doors, when you're constantly banging on the doors, when you constantly feel like you are constantly repeating yourself, it can be quite unempowering. And I think today, a lot of people that we've spoken to, and we've also got members of our national network that we at the moment currently are developing, and these are organisations that support these families directly. And also when we talk to parents and carers that are here today in the room from various parts of the country, the key message we seem to be getting is, but we've been there, we've tried to talk, we've tried to have our voices heard, nothing seems to ever change. I am hoping that everybody's here today that have committed their day and taken the time to be here can really support this programme, really support to take some real action, whether it be as themselves as parents and carers to continue working with us, to have a greater and united voice, to become champions of their children, to become champions from the community as well, or either as peer supporters, whether it be statutory services that have services that support disabled children and families, how they can have more practical, more cultural approaches to ensure that these families' needs can be addressed in the local communities, and ensure once again that families' involvement is central from the diverse communities they serve. Whether it be from practitioners who support and influence social policy, or who are delivering on several of the government programmes at the moment, supporting the aspirations of disabled children and people who really do need real commitment. I'm sure you all agree that it is time for real change. In the briefing paper, we not only looked at 45 separate pieces of research and studies, going back, I think initially I said to my colleagues, let's look at 10 years. Let's see what the last decade has really done. Has there been any real outcomes for these families? Particularly with the transformation programs of recent years, 3 years, £270 million spent on services to disabled children and people. Yes, there's many families that have actually benefited, but in reality, once again, the most disadvantaged group, black and ethnic minority families of disabled children and people, underrepresenting accessing short breaks, underrepresenting and influencing local decisions and decisions regarding their children. Still, key issues are still very pertinent today, limiting and poor access to information support, difficulty with language communication barriers, lack of cultural and holistic services and support, not having their processes put into place so they can ensure that they too can influence decisions that be made at a local level, let alone be able to support their child within their own family home. These key issues, after £270 million being invested, are still relevant today, and I'm sure there's parents out here right now would agree, and hence why we've made this journey. What we don't want to see is 15 years later, especially with all the new approaches that have been put into place, that is going to be the case as well. So, in the briefing paper, not only did we look at research, we talked to many parents and carers, and we asked parents and carers. There's so many key issues that are pertinent to these families in terms of ensuring that they could improve their lives as a family, have better information so they are aware what choices and opportunities are available for their children, right from the outset, right from early years, trying to get a job, make sure their child can have the same opportunities in childcare, etc., and be able to be involved in their community, be able to access school, education, be able to formulate friendships, have social network skills, to having acceptance within their community, with their family, and social other gatherings, etc. There is a lot of stigma. There is a lot of difficulties families are facing, and the way to really tackle this is by working together. So when we spoke to families and we looked at the studies, there were 5 key themes that are being highlighted in our report. Social disadvantage and poverty. Many of the families are still struggling. Many of the families are still not getting the correct disability living allowance. They're not aware of the support and the additional financial support they might be entitled to locally. Families, as you just heard, in terms of their housing conditions, are still struggling in terms of knowing where they can get information, who can advocate on their behalf, and how their cultural needs can be met. Sometimes not just appropriate if you've got 2 rooms downstairs, that one gets converted into a bedroom, especially when it comes to house and family gatherings, and families have preferences on having separate rooms to support and celebrate their family functions and gatherings. Access and support is key, and cultural identity. Families are still having difficulty knowing where they can actually go for support. You've heard here today there is a clear lots of support that families prefer within their own communities. With these groups and organisations, we must have had a list of 50. I have to say there's a handful of organisations still managed to survive, particularly with the cuttings, particularly because funding is so limited to them. And these handful of organisations have actually joined Include Me Too as a national network, but we hope that organisations here today and individuals will join to make sure that we've got a much more empowered and united voice.
We are not going to get access to anything. We have more cuts, more reforms to health and welfare, which means whatever excuses you might have had 2 years ago, 5 years ago, those excuses will carry on and on. Now they've got no money. 2 years ago, I remember we first had talked, you responded to surveys. We were told, well, your community doesn't really come to you, so we assumed you didn't need the surveys. And I think that for real action, he's talking about legal action, because actually there's not much case law. And I think there's so many of us representing a huge part of this country, and actually coming together behind this paper, but actually looking at a different, I suppose, course for us. Because otherwise, we can carry on talking, we can carry on researching, but until somebody legally challenges this, you know, simple things on equality impact assessments, nobody does this at a local level, that's across all statutory sector agencies.
But even that little bit of support is not out there. There's so many guidelines, and just because you work, you can't have this, and you know. So I just want them to address all the issues that have been raised today, and I just wish everybody luck in the sense, and the work that Parmi is doing is fantastic, and it's great that you've got so much support here today.
I think we have a lot of work to do. I'm addressing the policy writers. I'm addressing myself as well. And I've got Jagtar here and Balraj, and Chairman and others, my colleagues from the NHS. I think we have failed you, in a sense. It's not been easy. When you're on a BME, whether you're a BME director, or you're African Caribbean or Muslim or Sikh or a Hindu, working in a public service is not easy. But when we hear your stories, actually it makes me proud that we are doing the right thing. Because many of us are going through the challenges that you're going through as professionals. Sometimes we find, are we actually doing the right thing? Are we on the right direction? Why has it taken 15 years for us to still listen to the stories that you've been saying? I come from the Home Office, from the Criminal Justice. I could be sitting in a room like this and people could talk about racial attacks and hate crimes. Story after story after story. And that doesn't mean disabled people don't get hate crimes. We know people get killed because they're disabled. So when we're talking about BME children, BME families, BME carers, and being a BME myself chair, it's very powerful what you said. Although, I'm not professional in those areas because, thank God, I don't have a disabled member in my family. But listening to you, it just says to me that we have a lot of work to do. I came here today because of Parmi, in a sense, to tell you the truth. Because she's a very powerful woman. When she asked you to a meeting saying, I need you to come, I need you to attend. I have not met her before. It was Balraj's fault because he says, you need to meet this woman. Because she's very powerful and she wants to meet you. I thought, oh, and every time he says that, that means there's some work. But I'm glad I met her. For a number of reasons. And I want to congratulate you on the time for action, really, in a sense. I think the action's already gone, the time's already gone. I think we're chasing all the time. But if we can make a difference through this report, then it's been worthwhile. But I think we need to get into the policy writers, and I'm talking to now Jagtar, Balraj and Jamin. I think we need to start getting into the policy writers. And one of the things that we want to do, and I'll give you my commitment now, Parmi, in a sense on it, whether I'm going to be around or not around, we will make this happen in Midlands and the East. In fact, your report has already gone out to 150 leads out there this morning when you sent me that report. Because I wanted to make sure that we start with our equality leads. If we can't get the equality leads on board to push this forward, then what chance have we got with everybody else? Second stage, what we need to do actually is hold an event like this in each of the regions, in the SHA regions. Whether people allow us to do that or not, it doesn't matter. I think we need to make it happen. Balraj, Jagtar, Chaman, we need to make it happen. And we can make it happen, because we have lots of skills in this room. I'm not one of those who actually have to depend on others to make things happen. Otherwise, why be a director? Why be in my position if I can't make those decisions and help people like yourselves? And we need to do that. So I do apologise. I don't think we've done enough. In the last 3 years that I've been in the NHS, if you ask me how many meetings have I been at a senior level, every day I attend senior meetings. Ask me a question, how many times do BME disabled people get discussed? You won't be shocked. And I'm thinking here, sitting here, listening to everyone who said parents and carers. You have brought me back to earth again and saying, actually, Maqsood, what is the point of you meeting chief executive of SHAs and PCT chief executives and policy writers if the word BME is not even discussed on that agenda? Because I think somebody said it made a passion saying time is not just for action, we need to stop apologising. I think you're right. I think you're absolutely right. You shouldn't have to be sorry for what you're pushing forward. You shouldn't have to feel guilty for demanding what you deserve, and it's what your right is. And I think we've got to stop doing that. And we as policy writers and policy makers have got to be true to ourselves and say, when we go into meetings, are we discussing finances again? Are we discussing about reduction of people? Are we discussing issues around which is relevant, not even relevant to people in this room? Third commitment I want to give you is that we want to have an event like this, but it won't be targeting BME people. Because if we just keep talking to ourselves, then I think we failed you. I think we need to meet to the CCGs. They are the next people who hold the money and the finances. Health and Wellbeing Boards, they're the next ones with the power, with the finances. They're the ones that we need to have around the table. They're the ones that we need to sign on to this, include me too, into the rights report and so forth. They're the ones who should be actually listening to stories that I've listened to you and see what the reaction is. If they have a heart, they'll not walk away from this room without giving you a commitment, without helping you in the voluntary sector. Why should a voluntary sector organisation do things on their own? You need support because you're all taxpayers. I'm a taxpayer. And if I had a disabled son or, God forbid, a disabled daughter, I would want my daughter to have the service that your daughter needs to have. So please don't make apologies for putting your concerns forward. And I'm glad the minister's turned up. It's a shame she had to go, because I think she can do a lot. The chief executives can do a lot. But the challenge for us is this. and that's for me as well, is how do we actually get these cases to the decision makers who have the money to help the voluntary sector, so the voluntary sector can help the patients and the carers, if it's going to be a partnership. Because we have an opportunity. On one hand, it could be a threat, but on the other hand, it's an opportunity. When new organisations are being formed, that is the right time to actually get it onto the agenda. And I can give you a commitment, we'll do everything that we can, Remy, to make that happen with the help of the people in this room. I wish you well, but I'm not going to go away. I will be around because I didn't join the NHS so I can be in a director level and have tea and coffee and nice custard biscuits. I joined it because I belong to a minority. And I know what it's like to be a minority. And know how hard it is to be a minority, whatever faith or cultural background you come from. And it's double hard for people with disability because of racism and discrimination and everything else that comes towards it. So we have challenges ahead of us. It's not going to be easy because there's no more money left out there. But there are things we can do, and it doesn't always take money. To give you respect and dignity, your son and daughter, it doesn't take money. To come and see you, it won't take money. Because people get paid, whether you're a social worker, whether you're a health worker, whether you're a manager, they get paid to provide you with a service. They already gave the money, they already got the money. What we have to do is keep the pressure on. So congratulations for getting this far. Congratulations for getting your report out. But we have a lot of work to do. And I want to be in that partnership with you to make that happen.
Currently, Health Watch is developing. It will be in place by April 2013, but currently they are called links. And so if you know of any places that are called links, you need to get involved because the clinical commissioning groups are where the money is going to be, and they have to allocate resources equally. They also have to do equality impact assessments, and they have to also follow the equality delivery system. There's a social care white paper coming out, and I know for a fact by the Department of Health has just recently spoke to me, and they have entered advocacy into there, and they're going to be specific about the needs of BME disabled people, carers, families and children. I think it's important that all of the government, like I said, not just the DWP, but across government, across the criminal justice system, housing, education, employment, welfare benefits, right across, they need to be working together to get this right for us. Otherwise it's just not going to work. I will bring it back to ministers. You need to embrace it, you need to work with Parmi, we all need to work together, but most of all you need to give yourself a hand and thank yourself for still being here and developing things for your community and for yourselves.
I pledge that having heard the heart-rending stories today, I'm glad I came. I phoned Maqsood at 1 o'clock today because I was having a 2-hour appointment with the dentist. That wasn't painful at all, but hearing your stories really did get to my heart. So I'll make you 3 pledges. I'll make you a pledge that the NHS Confederation Conference on Thursday, where there'll be a large audience of people listening to what we as chairs and vice chairs of the Confed will do. I will mention this report and I'll mention what needs to be done. As a non-exec director of my hospital, I already know some of these issues because we have a equality diversity network, we also have a disability network, and we take advice from that. But I'll make sure issues around BME disabilities at the hospital are dealt with as best as we can through the various things.
I think for me this whole issue is very much bound up with health inequalities, and colleagues on the top table have already identified a number of levers in the system to use, such as equality analysis. I think for me there's 2 practical steps which the organisation could take. It would be writing to every primary care trust, and as the Health and Social Care Act is implemented and the purse strings move to clinical commissioning groups from April next year, it's to really ask them to evidence how they are commissioning to tackle the health inequalities on their patch. And their health inequalities will not only include young and disabled and BME people, there will be a whole raft of issues, but they need to evidence that. How are they accounting for the fact that they are the purse holders and they're tackling these health issues on their patch. Secondly, I think very much allied to that, you could also write to every local authority to ask them how they can provide assurance to you that they are meeting the needs of BME, disabled and other young people in their local authority. At a practical level, you could issue an FOI to the majority of local authorities, and I think the evidence and the responses will be very revealing.
We've met up with some of the people from inside the conference. Let's see what they have to say. So can you tell us a little bit more about yourself and some of the reflections on the conference itself?
Sure, my name is Maqsood. I'm the Director of Inclusion for the Midlands and East, and also the Director for EDS nationally for the NHS. And I thought the event was fantastic, really, excellent organised. And this agenda has been overdue with regards to, in my opinion. I think we have a lot of work to do. We've come a long way, but we've still got a lot of work to do. So one of the things that I've taken a pledge on is to make sure that the reports that's been highlighted, in a sense, gets to the policy and decision makers, because that's the most important thing, is to get to the CCGs, the new ones, the clinician groups and commissioning groups and so forth from that side. If we can get it to there, the new architecture of the NHS, then I think we've got a good start. Because the needs of disabled BME children and the carers and so forth is too much, alive out there. And some of the sort of the carers' stories I heard was very, very emotional in a sense on it. So it's made me think, as a policy writer and a policy person working with senior people, that we've got a lot of work to do yet. So I've taken some responsibility in the sense of helping the organisations to make it happen on a local level, regional level. So I'm really looking forward to working with them on that.
And Maqsood, there's always something that we can all do at home. I mean, what would you say are simple steps that some of our viewers can take to help?
I think the simple steps are going to be make it local, for example, because the local issues will be totally different to what national issues are. So therefore, start getting involved in the Health Watch. That's the new organisations coming up. Because if we're not active in the Health Watch, then we can't get our voices heard as a BME. So my advice would be on a local level, people should get involved in the Health Watch as much as they can. Then get involved in the CCGs, the new clinician and commissioning groups. That's very important that we actually get involved in that, because that's where the resources are going to be. That's where the funding and the priorities are going to be set. So if we can get onto those two ones, I think that will make a lot of a difference. So we can't do this by sitting at home. We've got to get out there and we've got to get engaged. We've got to become proactive in the local community to make it happen. Otherwise, we'll keep having reports, but nothing will happen on a local level. This is local action. We've got enough research and report now, nationally, that'll make a difference. We've got to make a difference locally now through the new structures. So the BME community has got to become really, really smart and intelligent in getting locally involved into the new organising new structures.
So it's build awareness locally of some of the issues and also some of the changes that are occurring in the NHS, and then start to get active within these organisations.
Absolutely. And we need to start from locally, because we have enough evidence now with regards to research, we've got enough evidence with our surveys, we've got enough evidence with regards to, over the past 15, 20 years, the needs of the BME sort of community, the children and carers. So what we have to do now is it's time for action, like the report says. This is the time for action. Although I think that the time for action was 15 years ago, but I think this is, again, another opportunity while the new structures are being developed in the NHS, so we need to do that. And I'm confident we can, because we've got some really good people out there, and I've heard some fantastic people, carers and individuals who will make a difference.
We're here now with Jagtar Singh, who is the National Director of a BME forum. So Jagtar, how did you find the event today?
I thought the event was extremely inspiring in the sense that we heard from patients and we heard from families and we heard from disabled people about the discrimination that they face and the difficulty they have in accessing funding. So for me, I'm going away with a renewed enthusiasm to make sure they don't face that discrimination.
And prejudice also exists within our communities. I mean, sometimes people of disabled backgrounds are shunned, their needs are sometimes swept away and not really talked about. Do you think there's something that we can all do within our own communities?
Yes, without a doubt. We have some phobias of our own, our myths of our own around disability, that it's our kismet, it's something to do with some bad karma in the past. I think we should dismiss those myths and we should get out research that is about current, about what these disabilities have caused, and we should be campaigning to recognise the abilities of our young people that have got disabilities, not the disability that they've got, and inspiring them to be the very best of citizens they possibly can.
We've got with us Balraj Singh, who's the head of inclusion for the West Midlands, and his name had been mentioned a number of times by our minister. So Balraj, can you give us a little bit more of an insight?
Yes, certainly. Hi everyone. My role in the West Midlands is to ensure that issues around equality and diversity are at the forefront of all the organisations that represent the National Health Service. So today was really important in ensuring that what was being said at a very high level, at a ministerial level, actually is manifest in some kind of action on the ground. And yes, you're right, I was mentioned a number of times, and I guess, really that's about pointing me in a certain direction that says we do need to take action with the kind of paper that's been launched today, with the kind of discussions that we've had today, but also with some of the really harrowing stories that we've heard. I've been in the National Health Service for 20 years, and one of the things that really recharges my batteries is hearing about real patient stories. When they're negative, they're pretty bad, but that's what it's about. That's what we're about. That's what the National Health Service is about. And as the head of inclusion, part of my role is to ensure that those experiences are really kept to a minimum and in fact eliminated altogether. So in terms of disability, in terms of black and minority ethnic communities, it really is for us to take the paper, to take some of the pledges that have been mentioned, and to make them work in our region, the West Midlands, so that in time to come, the West Midlands region is seen to be spearheading and setting the pace on issues around disability, on issues around black and minority ethnic communities, and really showing the rest of the country that we can produce papers, we can produce documents, we can produce research, but that we can do something with it as well.
What are some of the outcomes of this report? So what specific steps are you going to be taking?
The report itself talks of a number of recommendations and a number of solutions, or a number of perceived solutions. I guess one of the important things is that we all work together in ensuring that these solutions are taken forward. In terms of some of the practical steps that I'll take, whilst I need to go away and think a little bit more about what it means in the real world, I think one of the immediate things I would like to pledge to is that I have access to something like 45 or 46 National Health Service organisations across the West Midlands. I will ensure with Maqsood and with other colleagues that every single chief executive, that every single equality and diversity lead are aware of this research, they're aware of what some of the issues are, they're aware of the inequalities that some of the communities that have been mentioned face, and that we need to do something about that.
That was so enlightening and truly touching when you think about the state of affairs of disabled children, carers and families within black and minority ethnic communities. They tend to be poorer, they tend often to suffer from prejudice, both from broader society and from our communities as well. And it's interesting that faith-based traditions in particular embrace this idea of equality, yet often within faith-based traditions we shun the disabled. My real question is, what are you going to do about it? Because it's inevitable that these briefing papers and charities can do so much with policy and policy makers, but at the end of the day, we can all do something with our families, our friends and the communities near us. I believe it's really up to us to do something about it. So the question to ask yourself is, what am I going to do? Thank you for joining us today, and I look forward to seeing you again soon.